Lots of excitement here. The heart is beating fast here for a lot of folks here in San Diego, but be careful of that. World Heart Day is recognized this week. San Diego celebrated with heart disease survivors at the American Heart Association's Heart Walk at Balboa Park last weekend. And along with the thousands of heart-healthy San Diegans who showed up was San Diego's cardiothoracic surgeon, Dr. Alexandra Kharazi. Thanks so much for coming in here, doctor. Sure appreciate you being here today. Let's talk a little bit about our heart, the condition, what we can do to keep it strong. And we only get one ticker, right? We got to be careful. Talk a little bit about that, what we can be doing right now to make sure that we stay healthy.
Absolutely. So as we mentioned, cardiovascular disease is the #1 killer of men and women in the United States.
Right.
Responsible for about 1 to 3 deaths annually.
That's incredible when you think about the statistics, right? Like how many people this impacts. What could people be doing at home to maybe help out their diet or exercise? There's some simple steps, right, that we can do.
Like I tell my patients in clinic, keep it simple for sure. So the first thing, like you mentioned, lifestyle changes.
Okay.
So diet and exercise, we can start there. And even if there's no time to go to the gym, simple things like taking the stairs instead of elevators, parking your car farther away. These very simple lifestyle changes can go a long way early on. And then also knowing your numbers.
Right.
So the risk factors for cardiovascular disease, high blood pressure, high cholesterol, smoking, diabetes, family history, and just knowing those things to start really helps because then they can be monitored and tracked over time.
How does someone, if maybe they just having heartburn, they know something's wrong with their chest, like how do they differentiate what is really a concern? Is it a breathing issue, or walk us through that a little bit?
It can be. So, the media the movies depict heart attacks as like grabbing your chest and falling to the floor.
Obvious. Grabbing the left arm, right?
The left arm, the jaw, right? But in reality, it's a lot more insidious than that. It can certainly present that way. So if there is sudden chest pain, that is a concern, and someone should seek medical care immediately. But oftentimes, it can be heartburn related, or it can feel like a symptom of heartburn, jaw pain, neck pain, even nausea. And we call these atypical symptoms. And sometimes people just say, I don't feel right, or I'm more tired, I'm dizziness. It can present in this wide spectrum, and also it can be asymptomatic completely. So it can just go on for years and without any symptoms at all.
Say someone goes and gets their checkup and they're told, hey, you're high cholesterol, you really got to watch it. How does that compare to any potential heart concerns? Is there something they can be doing, and what's the correlation between the cholesterol and potential heart problems?
Absolutely. So what I like to say is like all roads lead to Rome. So people have different constellations of these risk factors.
Sure.
So someone may have high blood pressure, and somebody may have high cholesterol, and it may be worse. Each of the risk factors may be contributing differently, but the end point is they all add up and they can lead to heart disease. And so it's important to track all of those numbers and to know. And also, if you feel like you're being dismissed or misdiagnosed, it's always good to get a second opinion.
Absolutely, yeah. Talk with your doctor. Make sure you're getting those checkups. Specifically women, sometimes this gets unnoticed, right? Can you talk about that and why that is?
Absolutely. So women are more likely to be misdiagnosed and underdiagnosed, and we are more likely to present with these atypical symptoms and to be asymptomatic. So as such, we tend to actually present at later stages of heart disease. And by that time, the heart disease has already done more damage. And so it can, at the time of surgery, for example, when I'm operating on women, they tend to already have suffered, like, for example, a lower ejection fraction, and their heart isn't functioning as well because they've gone for a long time because they didn't have those symptoms, or maybe they did, but then they were chalked up to something else.
Make sure you get that checkup. That's for sure. Make sure you touch base with your doctor. Is there a website or some place where we can learn more about any ways we can work on our bodies and keep our heart healthy that you can send us to?
Absolutely. I like to always recommend the American Heart Association website. Or feel free to reach out on my website, www.alexkharazi.com.
Awesome. Doctor, thanks for coming in. Always appreciate your time. We'll be right back.